powers to be already have a list of anxieties as they await their new baby's arrival. But add in the coronavirus crisis and things have quickly become a lot more complicated, especially with hospitals issuing new regulations on who can be with the mom in the delivery room. I spoke with locals about what it's like to be pregnant in a pandemic.
Tori Satterfield is expecting, but she wasn't expecting this.
We had to cancel my baby shower twice now. It's been hard, And, definitely now because, with the baby, you can feel her kicking and stuff now on the outside. And I don't get to share that with my mom and my grandma and my sisters.
Hospitals around the country and here at home are changing policies amid the pandemic and limiting the number of people who can be with a pregnant woman during labor. Kern Medical, Adventist, and Mercy and Memorial Hospitals are all allowing one support person per mom. But a few hospitals, not here, have decided not to allow anyone in with the mother.
It was going to be my sister-in-law, and my 16-year-old niece in the room with me. And now it's just going to be me and my sister-in-law.
Because of that and fears about going into a hospital filled with sick people, more moms are considering home births.
Every hospital, every OB group, every obstetrician is taking every precaution possible to try to minimize those risks. And they've been reassuring moms that regardless of the circumstances, when they give birth, you're going to have a super supportive nursing staff, a super supportive doctor, and most importantly, we're going to make sure that the baby's safe and they're safe.
Dr. Roxanne Martinez does not recommend home births.
Home birth has a really high rate of complications. The rate is anywhere put out by ACOG of 25 to 50%.
While midwives say a home birth or birthing center isn't for everyone, it has some advantages in this pandemic.
What are we being told right now, right? Social distancing, stay away from big, public areas, stay away from groups. Unfortunately, I love hospitals. They're there for a reason. They're there to take care of people. Doctors are amazing. Nurses are amazing. They're all there to help us. But people need to feel safe, and one of the safest places really right now, by everybody's recommendation, is to stay home. So if people are low risk, that's one of their options.
Midwives in California are licensed by the state medical board and only authorized to attend the births of women considered low risk. That means no pre-existing health conditions and a single birth. That's not Tori. Because of a past heart condition, she's high risk. So while her birth plan may have changed, the location has not.